Hello everyone, I'm Dr. Carter. If you are one of the 120 million Americans currently managing high blood pressure, I want you to listen very closely to today's update. We are officially in 2026, and the landscape of hypertension management has undergone a massive shift. For decades, the goal of blood pressure treatment was simple: get the numbers down to 120, over 80, at any cost. But in 2026, the phrase "at any cost" is no longer acceptable. We are seeing a new era of medical science where safety means more than just avoiding a stroke. It means preserving your kidney function, protecting your cognitive health, and ensuring your quality of life is not sabotaged by chronic fatigue, weight gain, or brain fog. I have spent over 20 years treating patients in the United States, and I've seen far too many people suffer from side effects that were completely preventable. Many are still taking medications based on clinical guidelines from 2010 or 2015. Science has moved on, and your prescription should too. In this video, I'm going to reveal the safest blood pressure medications available in 2026, based on the latest FDA approvals and the updated guidelines from the American Heart Association and the American College of Cardiology. Whether you are about to start your very first prescription or you are looking to switch because your current meds make you feel miserable, this deep dive is designed for you. By the end of this presentation, you will have the exact knowledge you need to have a high-level conversation with your own physician. Before we discuss specific drug names, we must redefine what we actually mean by a safe medication in 2026. In the past, if a pill lowered your blood pressure without causing an immediate emergency, it was labelled as safe. That bar was simply too low. Today, as we move toward precision medicine, we use three specific pillars to determine if a medication is truly safe for long-term use. The first pillar is organ protection, specifically cardiorenal protection. We now prioritize medications that do not just relax your blood vessels, but actively shield your kidneys and heart from long-term scarring and fibrosis. High blood pressure is the leading cause of kidney failure in the United States. A safe medication in 2026 must be proactive in preventing that outcome. The second pillar is metabolic neutrality. Older generations of blood pressure drugs often came with a hidden price. They could trigger insulin resistance, push a borderline patient into type 2 diabetes, or negatively impact cholesterol levels. In 2026, the gold standard for safety is a medication that stays out of your metabolism's way. It should lower your pressure without raising your blood sugar. The third and perhaps most vital pillar is cognitive safety. This is a major focus in American medicine this year. We now have clear data showing that certain blood pressure medications can actually help prevent vascular dementia and Alzheimer's disease, while others may cause minor cognitive clouding. We are no longer just treating a number on a pressure cuff. We are protecting the human brain. Furthermore, we must address the issue of bioequivalence and generic manufacturing. In 2026, the FDA has tightened regulations on how generic medications are produced, but differences still exist. Safety also means ensuring that the medication you pick has a consistent release profile, so you don't experience dangerous spikes and crashes throughout the day. If your current medication is making you feel sluggish, depressed, or physically weak, it is failing the 2026 safety standard. True safety is the absence of symptoms and the presence of long-term protection. Now let's look at the specific classes of drugs that are meeting these high standards. When we look at the clinical data in 2026, one class of medication stands above the rest as the primary recommendation for the majority of Americans. These are the angiotensin II receptor blockers, or ARBs. If you are looking for the absolute peak of safety and tolerability, this is where we begin. In my practice, the standout winner for 2026 is telmisartan. For years, we knew it was effective, but recent large-scale studies have confirmed it as the king of blood pressure medications. What makes telmisartan unique is its incredibly long half-life of about 24 hours. This provides a level of protection that other drugs cannot match, particularly during the early morning hours, when the risk of heart attack and stroke is at its highest. Furthermore, telmisartan has a unique metabolic benefit. It acts as a partial activator of PPAR gamma, which helps improve insulin sensitivity and glucose metabolism. In an America where metabolic syndrome is rampant, this is a game changer. Other ARBs like losartan and valsartan remain excellent safe choices. Their primary advantage is their near placebo level of side effects. Most patients feel absolutely no different while taking them, other than seeing their numbers improve. They are also powerful kidney protectors, making them the first choice for anyone with early-stage kidney disease or diabetes. Now let's talk about ACE inhibitors, such as lisinopril. For decades, lisinopril was the most prescribed blood pressure drug in the United States. In 2026, it is still a very safe and effective medication, but it has fallen to a second-tier position behind ARBs for one specific reason: the cough. About 10 to 15% of patients on ACE inhibitors develop a persistent dry hacking cough. While not dangerous, it affects quality of life. If you are on lisinopril and you are doing well without a cough, there is usually no medical reason to switch. It remains a cost-effective, time-tested option for heart failure prevention and kidney protection. However, if we are starting a new patient today, the 2026 consensus leans heavily toward ARBs for their superior tolerability profile. Next, we move to the precision players. These are medications we use when ARBs aren't enough, or when a patient's specific physiology requires a different approach. First, we have calcium channel blockers, or CCBs, with amlodipine being the most famous. In 2026, we have perfected the use of these drugs. One of the biggest complaints with amlodipine in the past was peripheral edema, or swelling in the ankles. By 2026, we have shifted toward using lower-dose combinations or advanced, controlled-release versions of nifedipine that significantly reduce this side effect. CCBs are exceptionally effective for specific groups, including African Americans and the elderly, who may have low renin hypertension. They work by directly relaxing the smooth muscles of your blood vessels. They are metabolically neutral, meaning they won't affect your cholesterol or blood sugar, and they are highly effective at preventing strokes, which remains a top priority in American healthcare. Now let's discuss diuretics, often called water pills. In 2026, we are seeing a major shift away from the old standard, hydrochlorothiazide, or HCTZ. We have found that HCTZ often does not provide full 24-hour coverage. Instead, the 2026 guidelines favour chlorthalidone and indapamide. Chlorthalidone is much more potent and stays in your system longer, providing better overnight blood pressure control. Indapamide is particularly praised this year for its safety profile in older adults, as it has been shown to reduce the risk of stroke and heart failure, with a very low risk of causing electrolyte imbalances. The key to safety with diuretics in 2026 is precision dosing. We no longer use high doses that deplete your potassium and leave you feeling exhausted. We use low-dose chlorthalidone, often in combination with an ARB. This synergy allows us to use smaller amounts of each drug, maximizing the blood pressure lowering effect while virtually eliminating the side effects. If your doctor is still prescribing HCTZ as your primary diuretic, it may be time to ask them about the superior cardiovascular protection offered by chlorthalidone or indapamide. As we move further into 2026, we are witnessing some of the most exciting breakthroughs in the history of hypertension management. We're moving away from the one-size-fits-all approach and toward what we call targeted therapy. The first major breakthrough is the expanded use of ARNs, or angiotensin receptor neprilysin inhibitors. You might know the brand name Entresto. Originally designed for heart failure, in 2026, we are increasingly using it for patients with difficult-to-treat hypertension. Why? Because it doesn't just block the bad hormones that raise blood pressure, it actually enhances your body's own natural system to relax blood vessels and flush out excess salt. For a patient who has both high blood pressure and early signs of heart thickening, this is arguably the safest and most effective option available today. Another quiet revolution in 2026 is the use of SGLT2 inhibitors, such as empagliflozin and dapagliflozin. While these started as diabetes medications, they have become essential tools in our blood pressure toolkit. They work by helping the kidneys remove excess glucose and sodium through urine. If you are struggling with weight, mild kidney issues, or fluid retention, adding an SGLT2 inhibitor can often allow us to lower the dose of your other medications, reducing overall toxicity. We are also seeing the rise of the polypill. In the past, taking 3 different pills increase the chance of missing a dose or having a gastric upset. In 2026, high-quality triple combination tablets are the new standard in the United States. These combine an ARB, a calcium channel blocker, and a low-dose diuretic into one single pill. This improves adherence significantly, and studies show that taking one low-dose combination pill is actually safer for your liver and kidneys than taking a maximum dose of a single medication. Finally, we cannot ignore the role of AI and pharmacogenomics. This year, many of you can take a simple cheek swab test to see how your liver metabolizes specific drugs. This allows me, as your doctor, to see that you might be a slow metabolizer of amlodipine, but a perfect candidate for telmisartan. This eliminates the trial and error phase that used to frustrate so many patients. Even with the safest medications of 2026, how you take your medicine is just as important as what you take. Many patients come to me complaining of fatigue, dizziness, or even sexual dysfunction. My strategy, which I call the cocktail strategy, focuses on timing and synergy. First, let's talk about chronotherapy. There has been a long-standing debate. Should you take your blood pressure medication in the morning or at night? In 2026, the data suggests that for most people, taking your medication at bedtime is superior. It offers better protection against the early morning surge in blood pressure and often allows you to sleep through minor side effects like mild dizziness. If you are experiencing fatigue, it is often not the medication itself, but the fact that your blood pressure is dropping too fast. We now use a slow and steady approach, titration, to let your brain adjust to the new, healthier pressure. For those worried about mineral depletion, I often recommend natural boosters to complement your prescription. Magnesium glycinate and L-citrulline are two of the most researched supplements in 2026 for supporting endothelial function. When used alongside the medications I mentioned earlier, they can help keep your arteries flexible and may even allow for a reduction in drug dosage over time. Lastly, utilize your wearable technology, whether it is an Apple Watch, an Oura Ring, or a continuous blood pressure monitor. The data you collect at home is more valuable than a single reading in my office. In 2026, I use this data to fine-tune your dosage, ensuring you are never over-medicated during your active hours or underprotected while you sleep. To wrap things up, let's summarize the 2026 roadmap for blood pressure safety. If you are looking for the gold standard with the fewest side effects, an ARB like telmisartan is likely your best starting point. If you require more power, combining it with a low-dose calcium channel blocker or a modern diuretic like chlorthalidone is the safest path forward. And for those with complex needs, the new SGLT2 inhibitors, or ARNI therapies, are providing protection we never thought possible 5 years ago. Here is your action plan. Do not go home and change your medication on your own. Instead, I want you to book an appointment with your healthcare provider. Take the notes from this video and ask them specifically, "Doctor, am I on the most organ-protective medication available in 2026? Ask about the metabolic impact of your current prescription. Your health is your greatest asset. High blood pressure is often called the silent killer, but with the medications and technology we have today, it is a condition we can manage with almost zero impact on your quality of life. I want to hear from you. Which medication are you currently taking? And have you noticed any of the side effects we discussed? Drop a comment below. I read as many as I can to help guide our future topics. If you found this information helpful, please subscribe to the channel and share this video with a loved one. I am Dr. Carter, and before I go, please remember, the information provided today is for educational purposes only and does not constitute medical advice. Always consult with your personal physician before making any changes to your treatment plan. Thank you for watching, and I will see you in the next video.